Hello, everyone. Happy Friday afternoon. Thank you for joining us for the UAB Town Hall meeting with RettSyndrome.org. We have a lot of wonderful presenters today who are going to share some information about your clinic in Alabama. And we're going to be sharing some information about RettSyndrome.org and some things going on in the Rett world. Before we get started, though, I would like to give just a few operational announcements about GoToWebinar if this is your first time using this application. So all attendees are in listen-only mode. Your webcams are not on and you are automatically muted, so you don't have to worry about anything in your background disrupting the presentation today. We've received many questions submitted prior to the start of today's town hall through your registration, and we'll be fielding those at the end of the presentation. But if any questions come up in your mind as we go through today's content, feel free to type it into the chat box. And we'll field those that are relevant for today's presentation at the end of the slides, as long as we have time. And if any that we don't get to today, we will address offline. Okay, so you can sit back and relax. Also, today's session is being recorded and you'll receive a link to the recording within a day or two, so you don't have to worry too much about taking notes. You can revisit the material and you can share it with anybody that you know who wasn't able to attend today but is interested in the information. Okay, so welcome to our town hall. My name is Paige Nues. I'm the Director of Family Empowerment with RettSyndrome.org. On behalf of our board of directors and everybody on staff and as volunteers with the foundation, we're so happy to have you with us today. Our educational programming is an important part of our mission, and we believe that everybody who wants to avail themselves of information about Rett syndrome should have that free of charge. And we thank our sponsors, Acadia, for being able to sponsor our education programming so that even more donor dollars can be directed to our research programs. Special thank you to Acadia Pharmaceuticals. Thank you. Our agenda today is we're going to have a brief welcome, and then we're going to hear from your team at UAB, the Civitan Sparks Rett Center and Rett Syndrome Clinic, and Children's of Alabama. And they'll be sharing some RettSyndrome.org updates, and from myself, from the organization, and from Susan Lee, your state representative from Alabama. And then we'll go into QA. So with that being said, I would like to invite Susan Lee, your parent representative for the state of Alabama, and mother to Alyssa, and patient family of the Rett Clinic, to orient us to kick off today's town hall with some remarks about what we are all about, to keep us focused on the work of our children and how together, partnership between the clinic, the foundation, each other as families, that if we work together, we really can make progress happen and make our journey with Rett syndrome better. So Susan, I'd like to go ahead and, oh, sorry, my slide wasn't advancing there. There you go. So welcome, Susan. Can you tell us a little bit about you?
Hey guys, my name is Susan Lee. I am the state representative for Alabama for RettSyndrome.org, the family empowerment representative. I am the mother to Alyssa, who is now 13 years old. And I feel like I probably know a large majority of you. I can't see any of you, so I'm not sure who all's on. But if you don't know me, I want to know you. So first, a little bit about Alyssa. She was diagnosed May 3rd, 2011. She is now 13 years old, so she was right after her 3rd birthday when she was diagnosed. To say that was terrifying is an understatement. I had already kind of figured out that was the diagnosis just through my own research and journey through the information on the internet and exploring, but I'm not telling you anything you haven't experienced either. It's terrifying. It's a date I'll never forget. It's something I'll remember forever. From the moment I heard the words Rett syndrome, I know I can tell you exactly where I was, exactly what I was doing. And I feel like that's something, after talking with so many of you guys, that's something that sticks with us forever. It's a traumatizing event in our lives. The journey since then has been scary. There's been so many unknowns. There continue to be lots of questions. Many questions still remain unanswered, But when I looked back at where we were back in 2011 to now, the progress that has been made in Rett syndrome, research in Rett syndrome, studies, and just what we know about our girls, as well as ways to try to help keep them healthy while we search for that cure, is astounding. It's promising, and it gives us hope every day for our girls and boys with Rett syndrome. 10 years ago, there were no clinical trials. And now I looked back and I was counting up, and Alyssa's participated in 4 clinical trials, as well as an educational study. With the discovery, every discovery brings more answers, and every trial brings new hope. It brings hope for Alyssa, it brings hope for her future, and hope for all of our kids with Rett syndrome. RettSyndrome.org, as well as the UAB Rett Clinic, have been an integral part of our journey from the very beginning. The first day I heard Rett syndrome, I reached out to Paige, I reached out to Jane, and I reached out to another local family here in Alabama that I had previous contact with, that I knew they had a child with Rett syndrome. And all of those pieces together have carried us through our journey. The staff, the support, the connections that we get, and the encouragement are invaluable. We're blessed beyond measure to have Dr. Percy and Dr. Anantz and Jane, Jerry, Susie, and Megan all within a stone's throw of our location, to be able to have them on Team Alyssa, to have them, you know, at my back when I don't know who to turn to. I always know who to turn to. I pick up the phone, I email, and I know that they're going to get right back to us. So we're blessed to have them to help Alyssa continue to grow and learn and progress. And with RettSyndrome.org and the UAB Rett Clinic's help, I'm excited for our future. I'm excited for Alyssa's future. I'm excited for the future of all of our boys and girls, as well as Rett syndrome in general. I think big things are coming, and RettSyndrome.org as well as UAB are behind us the whole way.
Thank you, Susan. That is an incredible introduction and welcome, and thank you for sharing your journey with Alyssa and how your relationship with the clinic and with RettSyndrome.org has propelled you to a place where you can be a volunteer representing the community and helping families. I know you have helped so many. And we're going to hear from you a little bit more later after we hear from the clinic team. So thank you very much for those words of inspiration and advice. And now I'd like to invite your Rett Clinic team to turn on their webcams to introduce themselves. As Susan mentioned, you all are so lucky to have the world's premier center right in your backyard. This team collectively represents dozens of, I'm sorry, I'm going to change this over to you. Change the screen over. There we go. I see your webcams now. All right. So collectively, you all represent decades of wisdom, knowledge, research, care, support, empathy, concern for all children with Rett syndrome. You have written hundreds of publications, helped us expand our understanding of the disorder, and welcome related disorders that have emerged out of what was in the early days considered atypical Rett syndrome. You have marshaled us along in ways big and small and incredible from your seat. And we thank you so much, and thank you for being with us today to talk about the clinic. So we have a lot of families with us. Some are new and haven't had a chance to come to the clinic. And oftentimes new families ask, why would I go to a clinic? What am I going to get out of that visit? Sometimes parents of adults also ask, your clinic is at a children's hospital. What's in it for me? And we also find ourselves at a very unusual time in the crossroads of history, living with a medical condition and a child with a rare disease in the time of a worldwide pandemic. And we know that has greatly changed the operations of clinics across the country. So we've had a great time having town halls with all of the clinics across the country talking about what it looks like in the time of COVID to have appointments in outpatient services and inpatient services. And we just, with all of the things that you all have going on, we thank you so much for being with us on a Friday afternoon to tell us where you're at with your clinic and where things are headed, and a little bit about the research that you're conducting right there in Alabama. So I'm going to, let's see, Dr. Percy.
Good afternoon, everybody. It's a pleasure to be here and to speak to a screen, not seeing anybody but the people I know. Just would like to begin by introducing the team. Of course, I've been involved in Rett syndrome studies since before 2000. Since that time, we have been engaged here with a regular clinic, and at least over the past 17 or so years, we've had a regular clinic with Susie Gertz, who's our dietitian. She can wave her hand. Jane Lane, who is our clinic manager and knows a very, very large amount about Rett syndrome and what families are dealing with from day to day. And then, of course, Jerry Childers, who isn't here, but he is our clinic administrator, our data guy, and general IT help when at least I can't figure out what to do. Since that time, and in the last few years, we've added another child neurologist who is also a board certified pediatric geneticist, Mitha Nath. And we hope that she has the time to log on. She is in clinic this afternoon and has some childcare responsibilities of her own. And then Megan Watley is a study coordinator who's been working with us now for some time, diligently working with the clinical trials that we have going on, both at the University Hospital and in the Children's Hospital here. So this is our group. We have a great deal of experience, and we have, over the years here at UAB, evaluated more than 500 girls or boys, some women, and we have a database of active participants of more than 200 individuals. The next slide. So these are the clinical services that we provide with our group here. We will evaluate children and adults of any age. Some years ago, we were contacted by a emeritus professor from the Evansville College or University about his sister. And we went up there and confirmed a diagnosis at her age of 66. But we have seen also girls and boys less than 1 year of age. So we have covered the entire spectrum. You might say, well, what's a pediatric neurologist doing seeing adults? First of all, child neurologists actually spend a year in adult neurology. So we are very comfortable dealing with adults and with their neurological issues. But we've also become very comfortable over the years dealing with Rett syndrome in individuals of any age. So what do? We make and confirm initial diagnoses and then continue as possible with follow-up care and assessment. Since 2006, we've had a natural history study, which is gathered and stored information in an anonymized way at the University of South Florida database. And that study will end at the end of July of this year. So we provide direct care with child neurology and genetics. Because I have done it, but Amitha does it much better to explain the genetic findings in a clear and understandable way. We provide growth and nutrition assessment. And that's where Susie is instrumental in providing guidance to families about how to manage diet, whether it's orally or by gastrostomy tube or both, and to deal with such problems as may arise related to their nutritional issues. We also provide guidance on common problems. Many of these girls or women and boys have problems with multiple systems. Parents with children with Rett syndrome understand that very commonly. But for example, gastrointestinal problems are present in the vast majority of girls, and other issues including orthopedic management, kidney stones, and so on, and gallbladder dysfunction are important. We work with the primary care team in a parent's hometown. As a regional clinic, we see girls from all over the East, but mainly from the Southeast. And so it would make very little sense for us to provide consultations here. We try to arrange the consultations in the parent's home base, or wherever that might be. And this also goes for therapy. We believe strongly in the role of physical, occupational, and communication therapy, and behavioral therapy if needed as well. We provide recommendations for other medical specialties and for health maintenance, and we are always available to discuss these with practitioners in other locales. And finally, we provide information about the kinds of research that are ongoing, as well as the individual trials that are currently ongoing. Next slide, Jane. And please, the two of you butt in when I've left something out. We have, this is an interesting time. Beginning in March, we will move our base of clinical operations to the Children's Hospital of Alabama, and we've been working diligently to make certain that that will begin, and our first clinic is on the 2nd of March. Even though we're at Children's and it is a pediatric facility, there is no age restriction for individuals seen in the clinic there. Unlike the natural history study, where the study was done under funding from the National Institutes of Health, beginning in August, we will be requiring fee for service, and to use the facilities at Children's Hospital, there will be a facility fee beginning already in March when we start the clinic. However, we've been assured by the people who are in charge at Children's that no one will be denied service. This may require pre-certification, although as the attending physician and leading physician for this clinic, Dr. Ananth and I will not necessarily require pre-certification. This will really be determined by the type of insurance coverage, so that the family will be called by the Children's of Alabama in case pre-certification is required by their insurance, and they will go over the various forms that need to be provided. However, again, no one will be denied coverage, and even in situations where insurance coverage may be less than ideal, there is a sliding scale which is arranged for by Children's, and it is a very accommodating scale. The people in the budget or the financial office at Children's have told us that they have provided a great deal of care at low costs forever. You would need to call Jerry Childers if you are new to our clinic and need to schedule, or Jerry will be calling you to remind you that you have an appointment coming up and what information needs to be provided.
Alan, let me say here that we're talking about pre-certs from an insurance standpoint, but a referral from a primary or some physician subspecialist or primary is not needed. Families can call us. We don't require another physician saying that their child needs to be seen.
That's correct. Thank you. The next slide. So what are the advantages to moving to Children's of Alabama, if any? Well, one is that it provides assurance that we will have a continuing presence at the Children's Hospital with a Rett Clinic in Alabama. We have a long relationship with Children's Hospital in terms of financial support through philanthropy, and the Rett program is very important to the administration and Children's Hospital. Also, it provides a number of services that we have not been able to provide directly in the Civitan Center, where the clinic has been for many, many years. If we need or we desire laboratory testing and it needs to be done at that time, it certainly is directly available. Cardiograms can be done. Many times we ask parents to arrange these at home, but sometimes that can be difficult, and we can easily obtain that in the same day. And we also can provide for X-ray and other diagnostic tests if necessary, and if they can be accommodated in the same time period. And finally, and perhaps most importantly, there's actually food directly available. So there's a cafeteria there, and you are free to take advantage of that either before or after the clinic. And the food, I think, is generally good for cafeteria food. It's obviously it's not a five-star restaurant, but it is quite good food. There is, as I said earlier, strong awareness within the children's community of Rett syndrome. We have many clinicians there who have seen children with Rett syndrome, and even within my own division of child neurology, which I rarely visit, there is strong awareness in that division about Rett syndrome, and many of my colleagues in child neurology, particularly the epileptologists, provide important services for these girls, particularly those who have seizures. Next slide. So this is a bit of history. Our first clinics at UAB were in 1993. We started in the Sparks clinics, or Civitan Center. We were basically a stone throw away from here, and then we were up the street when the Sparks clinics moved up the street, and we were there for many years. And then in the early 2000s, we moved the entire clinic operation here into the Civitan Center, where we have actually a nice facility. We would have loved to continue it here. However, when we asked to be affiliated more closely with Children's Hospital, and they came over and evaluated our space, they said we didn't meet hospital standards. So we decided we needed to go to a place that had hospital standards. One of the features that we need in a clinic is a large room, because many of the These girls come with families, extended families, and many of them are in large wheelchairs. And most of the clinics in the Children's Hospital are relatively small rooms, because children can walk in and they have one or two parents, and that's about it. But these spaces opened up with the construction of the new hospital and reorientation and development of new clinics. And these rooms that we will be using, a room is really quite large, and actually even larger than the space we are currently occupying. So under the natural history study, we collected data not only at UAB, but also at several sites along the eastern seaboard and the Gulf Coast. And to deal with the lack of geographic distribution, we had travel clinics at Oakland, Chicago, New Jersey, and Florida. And that continued until 2014, when we had a new application approved, which dealt only with Rett syndrome and other disorders related to it, such as the duplication syndrome, the disorders with FOXG1 and CDKL5, and other girls who looked, or boys who looked like they had Rett syndrome but might have had a problem with another gene. We collected a large amount of information on an aggregated total of more than 1,500 individuals, and we've written probably 50 or more peer-reviewed papers that have been published across that time and dealt with a number of subjects. And in addition, we provided a large number of reviews. Many of you are aware that this is next Friday, I believe, is a rare disease a program of the National Institutes of Health. And as part of that, I provided a poster which will be available for people who visit that, obviously virtually, but it details pretty much what we've accomplished over the years. And one of the important, or two of the important events that we entered into beginning in 2015 was a study of what are called evoked responses, so visual evoked responses and auditory evoked responses, done at 5 specific sites. And with each of these disorders, which show quite abnormal findings compared to controls, their own siblings, or it also showed quite strong differences between the 4 disorders that I mentioned. The second part of that was to create a biobanking program where we now have collected samples, blood samples, or in some cases swabs from the gums for DNA studies, but also blood samples for studies of RNA and for proteins, or components obtained in the plasma. That is a very valuable bank, which has now 700 samples, some related to siblings of the individuals, some related to their parents. But this is a very valuable bank, which will be maintained by rettsyndrome.org in the future. All samples are stored at the Greenwood Genetics Center, and I only can imagine that this will be expanded in the future. Now, beginning with this year, and as I said, next month, we're moving the clinic now to Children's of Alabama. It will be a fee-for-service, but still will function under rettsyndrome.org as a center of clinic of excellence or center of excellence. And we are hoping that this moves forward very well. And we can welcome now Amitha Ananth, who is my new associate here, and she is actually not so new. She's been here a while, and she is really does me proud to have a child neurologist as well as someone who is expert in genetic disorders to assist in the load. And you can see that she's handling or holding her now almost 4-month-old. So welcome, Anitha. And that brings us to any questions for us, but I think in interest of time and fluidity of the program, we will move on directly to Susan and come back to the questions. Paige, you can take it away, or Susan.
Yeah. Okay. Do we want to do that and then come back to the research studies?
Yeah.
At another time, or?
Well, if you want to talk about the clinical trials, so we have one clinical trial that has.
Hold on a second. You want to pull up the slide, Jane, or are you frozen? I can share my screen if you'd like.
Sorry, yeah, I'm sorry. I can't get away from the cameras once Dr. Anant came on.
Oh, okay. Thanks for letting me know that. And
yeah, so if you'll take it back over and find the right one, because I may have clicked off of it.
Okay. So sorry. Let me technical difficulties, everybody, on a Friday afternoon. Okay. Just bear with me for 1 second and I will be able to pull up your slides. Okay. And welcome, Dr. Anant. Thank you very much. And thank your newest Rett syndrome teammate for joining us as well today. Okay. And I'm going to there we go.
So,
okay, let's talk a little bit about research. Thank you so much for giving us your clinical background and welcoming your team. And I know you all are involved in a ton of research studies at your site as well. So take it away, Dr. Percy.
Clinical trials that are ongoing currently at UAB and throughout the country. So we have our phase 3 clinical trial with Acadia. It's a trofinetide, which is an IGF-1 peptide. It starts in 003 as a 12-week double-blind placebo-controlled study, and all of these studies are ages 5 through 20. The prior phase 2 trials were in adults first, and then in the children 5 through 16. The study is designed to enroll 184 individuals with 170 some completing the study enough to provide statistical power for efficacy. We also have the 004 trial, which is a follow-on open label study. It's a 40-week study of the same children who have already been through the double-blind phase. Now, there is one exception with this, and that was brought on by COVID. Many of the individuals who were in the double-blind study could not complete the full 12 weeks, or even if they did complete the full 12 weeks, institutions were closed and the study was interrupted. So we are now back on full activity. We've been so since October. We've enrolled more patients, more children here, and we have reactivated those who were at some stage in the double-blind study, now going into the open label phase. In addition, the company is discussing a study in 005, which would be a further open label study to allow individuals who were willing to participate to continue in an open label until the study is completed and can be reviewed by the Food and Drug Administration. And finally, there's an 009 study, which is a 12-week open label study for individuals, girls who are 2 to 5 years of age. This presents some issues because some of these girls may still be undergoing regression, and I believe that's why the company decided to do this as an open label study.
And Alan, point out that 009 is not, I mean, that's on the horizon. That's not ready for prime time yet.
And even 005 is still on the horizon. We don't have the full protocol yet for review and submission for IRB approval. So those are the details in the studies with trofinetide. In addition, we completed the double-blind and open-label portions of the Anavex trial, which was a study of an agent that also has shown to have general improvement in the animal model, just as trofinetide did. It's for 18 to 50 years of age. It was a double-blind study with then the open-label extension. And they're currently undergoing a discussion, again without actual protocol yet, to extend the open label portion of this for an additional period of time, I think up to 21 months. The third study we have is an investigator-initiated study. Dr. Newell at Vanderbilt was the named investigator, although it could have been anybody. This is funded by IRSF, the Rett Syndrome Research Trust. It's a study of ketamine, and specifically for breathing abnormalities. It involves children at 6 to 12 years. It's a double-blind study. It's only 4 weeks in length. It does require that the children wear a vest, which is outfitted to capture their breathing while awake and asleep. The enrollment in that study has also been adversely affected by the COVID pandemic, although the funders are hoping very much that this can pick up and be carried to conclusion. But there's still a ways to go, and that is one area where anyone who's interested in a short-term trial, and we would be quite welcome to accept their request to enroll in such a study. There are other studies on the horizon. We've heard, and you've all heard, about gene therapy, and you may see more on social media than I do, because I don't really look at social media. But Novartis Gene Therapies is the current entity involved in this. It's started with a company called Avexis, which was acquired by Novartis. They functioned independently, although being acquired by Novartis, but subsequently Novartis thought it would be best to go with a new entity, Novartis Gene Therapies. The last I knew, they were looking at animal models and the routes of administration. They have been doing studies in mice, but they also have a non-human primate that they have been looking at it as well. However, I know of no new information for more than a year. I'm certain that COVID has caused great difficulties with them as well. And finally, even though the NIH-funded natural history study ends at the end of July, RettSyndrome.org has agreed through the Centers of Excellence to continue this natural history study such that data that has been acquired in the past will be continued at some form in the future, and we will have the continuation of data, which is really invaluable. I, in another role, am the co-editor of a journal, and we looked at recently a paper or review on Down syndrome. And interestingly, many of the gaps in knowledge that occur in Down syndrome are the same gaps that exist in Rett syndrome, in probably all such developmental disabilities. We simply need more information across the board. And one of those is extended natural history studies that gives drug companies and the Food and Drug Administration the knowledge and the idea that we've acquired substantial information that can be used to evaluate and validate the whatever drugs or agents are used in therapy. And I think that's the end of that. We can go on to the next slide, which I think is questions. Yep. But with that, I think we should hear from Susan.
Okay, thanks, Dr. Percy. And I am going to bring this back over to, there we go, to my desktop, juggling technology here. Okay, so if you all want to take a break and turn your webcams off for a minute, I'd like to share some updates. Let's see, my webcam was on and then it went off. Yeah, we're getting a Friday afternoon jinx here. There you go. Have a drink of water and relax a little bit, and we'll come back to you in a moment for Q&A. So we have had a lot of things happening at rettsyndrome.org this summer, as has Alabama. So we're very excited for you moving over to Children's Hospital, and thank you for giving me a chance to share some broader information about what's coming out of rettsyndrome.org to help you, all of us as a community, progress in the arenas of research and family empowerment and family support and advocacy. So I'm not going to dwell on our entire mission, but I want to remind everybody who has been with us for a while or is new to the world of Rett syndrome that our foundation is really committed to accelerating research and empowering families. So with that dual purpose in mind, I wanted to just touch on a few things that are coming out of our research program, which is a continued commitment to accelerating research in all domains of the disorder. It is a complex disorder and it will require pursuing multiple treatments, including gene therapy, treatment medications, and neurohabilitative therapies, to really enrich the lives and make progress and gains large and small along our journey. And we believe that a comprehensive approach is really the right strategy for helping families. And we remain committed to creating those solutions for today. Our Chief Science Officer, Dr. Dominique Pichard, did a wonderful recording that touches on all of the domains of our research strategy, and we can access that on YouTube, and I'll be happy to share that in the chat when I can get back to my keyboard in a moment. But we, in the interest of time today, I just want to let you know that on our YouTube channel, we have a rettsyndrome.org YouTube channel, and you can hear from Dr. Dominique Pichard about our research strategy. It's about a 10-minute video. And I want to focus on some really exciting programs that came out this afternoon. So families ask us all the time, there's so much great hope on the horizon. There are so many clinical trials. How do I know which trial is right for me? Well, you're lucky in Alabama, you're just a phone call away or an email or walk into the doors at the Rett Center to ask those questions of some really trusted partners. But not everyone across the country or around the world has access to the same information. And so we rolled out a tool called the Rett Research Ready program that enables you to go online anytime, day or night. So nights or weekends are frequently when families have the time, the downtime to do a little research in the area of research. And this tool is available to you 24/7 to go onto our website and access information about the multifaceted research program that we run out of rettsyndrome.org. And it's also a tool that is really helpful for clinicians who are asked that question, what research is the right study for my child to participate in? And they may not be as well versed. Your child's pediatrician or general practitioner may not be as well versed as Dr. Percy and Jane and Susie and Dr. Ananth and others are about the programs that are out there. The research community can also have ready access to all of the research opportunities that are open, and sponsors can look at this site as well. And this is an extension of our investment in research, really to develop tools that serve you and help you connect, because our research cannot advance if we as families are not research ready, and if we don't understand how we can connect beyond fundraising, how we can enroll in research. It's a complicated picture when you talk about enrollment criteria, inclusion, exclusion criteria, start dates, stop dates, what locations are executing the research, do you have to travel, what kind of support is available. So this tool is available to you. It's just rettsyndrome.org/rettresearchready, and you can go online there and you can look at clinical trials that are available for you. And there's a lot of research programs that you can do from home that don't require you going into a center or participating in a drug trial. There are surveys, there are questionnaires. Dr. Percy said how important it is that we continue to gather data, and experts in the field of communication, of therapies, of medical care are conducting many studies where they just need information and they want to connect with you. So there are many different ways that you can contribute, and you can access the Rett Research Ready program and the Clinical Trial Finder, where you can put in some search criteria that are relevant to your family, and you can get a search list return of what studies are available for you. So we invite you to come and learn more about that tool and participate in that tool. And you can submit questions through that tool if you have any questions that aren't answered readily at your fingertips. And we're looking for ways to improve it, so we'd love to hear your feedback as well. Now, the other leg of our mission is empowering families, and that really comes from an understanding, and I as a parent of a teenager, a beautiful teenager with Rett syndrome, we know what it's like to get the diagnosis of Rett syndrome. And for most of us, there's not another child on our block, and oftentimes in our town with the same diagnosis, much less many children, much less an entire community. But with the tools available to us as a foundation, we're able to create community so that you as families don't feel that you're alone in this journey. We are committed to gathering the latest medical information, quality of life information, guidelines, connectivity through social media and forums, so that you are as prepared as you can be for this journey to advocate for your child, to provide them the enriched environment. And we remain committed to that. And these are some of the ways that we are committed to you, and we will continue to always look for new and improved resources based on the needs of the community. So it's a relationship, as Susan said at the beginning. It is a relationship of we as families, with clinics, with the foundation, working together to constantly evaluate our materials and improve so that our children's lives are more enriched. So out of rettsyndrome.org, I think almost everyone should have a copy of the Rett Syndrome Handbook. It is known as the Rett Bible. And if you don't, you can download an electronic version from our website, or we would be happy to mail you a hard copy. Just let us know. We have a state resource page, which Susan Lee is going to take us through in a little bit to look at the resources that are really state-driven for you and how you can access them in Alabama. And you have the absolute best representation with Susan Lee, someone who is well-versed in all aspects of life care and medical care and research care that is available. And I know I don't know when she sleeps. She fits 48 hours into a 24-hour day, but she's an incredible resource, and she's going to join us in a few minutes to talk about some things that will help you in your journey. We offer IEP support, clinics, referral lists, social media, as I mentioned. We have a monthly newsletter, the Rett Gazette, Angel Awareness cards, so many things that as you go through your journey with Rett syndrome, needs and wants are going to come and go. And we hope that at every point in your journey that we have something to assist you when you reach that point. A couple of other things that are big is advocacy and awareness. And we wouldn't be anywhere as a rare disease without making people aware of our story. And it's through stories that people become interested in our lives, and they become attracted and understanding of our children, and they want to help. World Rare Disease Day is something that has been adopted, started in Europe, and now it's a global worldwide event. Every year, the last Sunday of February is World Rare Disease Day, and the momentum and the energy around World Rare Disease Day has just grown. We've gone from understanding there are 7,000 rare diseases to I believe over 9,000 just in the short time that I've been involved with World Rare Disease Day. And Rett syndrome is just one of 9,000. So one of the trademarks or catchphrases of World Rare Disease Day is together we are strong. And this is an opportunity for everyone in the rare disease community to say, you know, we are in partnership together, and through partnership, we can make progress. So in honor of Rare Disease Day, we encourage you to change your Facebook profile page, take some time on Sunday to share your family story and how having a loved one with a rare disease has changed the trajectory of your life and impacted you, and what things are helping you get through the day. And through sharing that story, people will wake up and they will ask more, and they will become part of our shared mission. So we would also ask you on Sunday, on Rare Disease Day, to maybe take some time thinking about how you can partner in the progress of research, whether that's through making a donation, whether it's participating in a research study yourself, visiting the Rett Research Find tool to see if there's something that you might, now that as we're kind of emerging back to some normal times, is it time to reboot and reconsider participating in research? And let's all spend a little bit of time creating this global rare disease community. Another thing that we have coming out right now, maybe you got the newsletter today, or maybe you've seen it on our social media page. We have a great friend in Dave Clements. He's a photographer, a longtime friend to Rett syndrome through a personal connection with Kevin and Clint Black. And he had produced a book called Raising a Hand, which features some incredible, iconic musicians who raise a hand for those who don't have a lot of hand function. And all the proceeds go to our research program. And they are in the process of developing volume 2. And you can see some really incredible stars now know about Rett syndrome, thanks to Dave and his incredible photography lens. And in this version of volume 2, they would really like to have families contribute at no charge, a tribute about your child. And they will match every one of the children who are submitted for Raise a Hand Volume 2 to one of these iconic musicians in the book. So those are going fast. We'll put a link to the form in the chat in a moment, but make sure your child is recognized in this book. It's going to be a pretty special thing that you'll cherish for years to come. Okay. Another thing that we're really excited about, and I think all of us are craving, is some time together again. And for those of you who've been in the journey for a while, you've attended many of our family conferences in the past, and being together in person at either a national conference or at a regional Ed Day has had to be put on hold. And we have put a flag in the sand, and April 27th through 30th, 2022, we are booked at the Gaylord Hotel in Nashville, Tennessee, and we hope that everybody will be ready and prepared to join us for Ascend 2022. It'll be a wonderful summit, and we hope to see you all there. So mark your calendars and start saving, and we'll see you in Nashville. Okay. So other things that we produced this summer, when COVID struck and we found ourselves under shelter-in-place orders at home, both in the US and worldwide, we rapidly deployed some experts to do some Facebook Lives with us to let us know, for those of us who found us at home without our regular therapies, without our school environments, with unsure access to medical care, what are the things that we could do to continue an enriched environment in our home? And many of those Facebook Lives, we've come to realize upon reflection, really have a very long shelf life. we brought in experts to say remotely how to move and stretch our kids, positioning, aquatherapy, communication. What are the simple things that we can do day to day to really transform the development of our children? And those Facebook Lives are still recorded on our website, and we encourage you to take advantage of taking a peek at some experts who zoomed in by webcam to some real families' houses and worked remotely with young women, children, and adults with Rett syndrome to figure out ways to do an enriched environment. So check out those Facebook Lives. We also have periodic community updates by our clinical community, captured and produced by our medical advisor, Dr. Tim Banky out of Colorado. And we just had an update he made a couple weeks ago talking about return to school, therapies, vaccine, and whatnot. And we encourage you to check out our website and keep track of those updates. We also run monthly Rett Ed webcasts, and these are live webcasts every month. We invite an expert in the field of Rett syndrome to come and talk about an area of expertise that you have asked us about, that we see as a trend in the community of unmet need or misunderstood need. And these have grown in popularity. The attendance is incredible. It's a really wonderful event. And again, we were already doing this before the pandemic, but it has served us well through the pandemic to continue this programming. And we have some webcasts coming up next week, March 9th. The communication guidelines, co-author Teresa Bartolotta will be talking about real world applications, so that we're a year out of having the communication guidelines published and available for SLPs, AAC specialists, educators, families to get their hands on and try to put to use. And Teresa's going to be interviewing some real world people that have tried to apply the communication guidelines. We're going to be talking about that. And April 13th, we're going to meet with Dr. Bernard Suter to talk about males with Rett syndrome and boys and males with MECP2 mutations. And on April 23rd, we're going to have a double feature in April. We're going to be visiting part 2 of What Hurts, addressing and treating pain and Rett syndrome. A difficult topic and one that families really struggle with nonverbal, mostly nonverbal children, is where does it hurt and how can I help her or him? So please sign up for these. They're no charge, and they're on our calendar on our website. So we also, moving on from the webcast, which is kind of a live opportunity for you to talk to experts on specific symptoms or issues that are in your life that you need more information about. We have guidelines that are available both print and electronic for managing scoliosis, for managing nutrition and digestive health. And this primary care guidelines was really a collective effort of all of the clinicians across the country and working with experts around the world to condense kind of a checklist of tests, exams, different symptoms and body systems that should be kept and not have an eye kept on them in your journey of Rett syndrome, from having a young child through to an adult. And it really is to help you be a partner in your child's care with the healthcare system. So please download the primary care guidelines, or we'll send you a print copy. You can find them on our website. And we also did a Rett Ed last month on the primary care guidelines, and you can access that recording on our website. We already talked about the communication guidelines, but I really cannot emphasize how useful these guidelines are for progressing your child, whether an early learner or an advanced communication user. Using high-tech devices, we all have a journey that can progress, and these guidelines really are there to help you and the professionals working with your children to advance those communications. So you can get those online. Okay, so those really are just the highlights of things that have come to fruition thanks to your support and relationship with us, and we're pleased to bring you both programs for advancing research as well as for empowering you as with families on your journey. But what is the global view of Rett syndrome is also a very personal journey, and what is available to you resource-wise, support-wise, is in the US very much driven by your state. And So as much as we can know what you should be doing for your child with Rett syndrome, a lot of, again, the resources are available, state-driven, in the community of families who are living in your shared environment. It's really important to build community, and there's no one better at building community than Susan Lee. So Susan, if you are, if you're with us, if you can turn on your camera, I'd like to invite Susan back on to talk to us about resources in Alabama and how to access those resources, and to let you know, while Susan's pulling up her slides, that we have families that are with us today from surrounding states. And if you visit our website, you can easily find your representative for Georgia or Tennessee or Florida, but we're going to focus on Alabama today. So, Susan, I see your slides. Why don't you tell us, remind us of, for those who may have joined a little bit late, give us a little background about yourself and talk to us about your role as the state rep for RettSyndrome.org.
Okay, thanks for having me back. Again, if you joined a little late, my name is Susan Lee, and I am the Alabama Family Empowerment Representative for RettSyndrome.org. So part of what I feel like my job is to be there for you guys. In Alabama, I want to be your connection to help you find those resources, to help you find the answers to questions, but also just to be a listening ear, to encourage you to just be there, to celebrate the amazing things that our kids do, and to cry with you when we have those sad moments as well. So I have been blessed to be the family empowerment representative for really almost 10 years since Alyssa was diagnosed. And I started out as Alabama and Mississippi, so I still have some of that connection with some of those Mississippi families. And like Paige said, if you're in another state, you're not in Alabama, feel free to reach out to me. Take down my contact information, because I continue to help some of those families, get you in contact with your state rep. But I'm working with a family in Georgia right now on some educational issues. I've got a family in Florida that I'm helping with as well. So I am not just here for Alabama. If you want to reach out to me, I'm here to listen. So I'm going to kind of go through these quick because I want to save some time at the end for questions. Jot down my information. This is my phone number, my email address. You are welcome to call me, text me, email me anytime, day or night. And when I say that, I mean that. The families that know me know that they can text me. I had one family text me at 11:30 one night saying, I think my child just had their first seizure. And I was honored that they felt like they could text me and email me, and we were able to jump on the phone and call and, you know, talk through the situation. So I want to be there for you guys when you have an issue or when you need a resource to somewhere. The other way to stay connected with us is through our Alabama RettSyndrome.org Facebook page. So I know not everybody's on Facebook, but that's really such a central place that we can share information. So if you are not on Facebook, it's extremely important that you contact me at the email so that I have your email and I can contact you, because we're going to be posting some fun activities on the Facebook page. And if you're not on Facebook, I have no way of getting in touch with you. So make sure I've got your contact information as well. So the next slide, I think everybody here knows the importance of our Rett Clinic. They know how blessed we are to have, I feel, the most amazing Rett Clinic in the country. But from a parent perspective, I want to encourage you to get to know the doctors, get to know the staff at the Rett Clinic, and let them get to know your child. It's not just a doctor's visit. It's a relationship, it's a partnership, and it has benefited Alyssa beyond measure. There are times that things go on and you can't just call your family doctor because they don't know. They don't understand Rett syndrome, or they'll say something at her annual visit with her pediatrician, and I'll go, let me get back to you on that because it just doesn't sound right. I can email Jane or Dr. Percy or Dr. Anant and get an answer very quickly to either confirm or help us correct some information or make sure that we're just on the right track for Alyssa. I'd reach out to keep them informed of major changes. If Alyssa's in the hospital, if there's a big issue, if we have a surgery coming up, I'll keep them informed. And then when I do need help, then they're always there. So I do think the importance of maintaining that relationship with your Rett Clinic is absolutely vital. School and community, which again has been severely impacted by COVID, but keeping your child engaged in school, in the community, continues to be important, and even more so important now that COVID is here and we're stuck at home so much. Think about keeping your child going out on frequent outings, keep them involved in community activities. Most of you know Alyssa is huge into Girl Scouting. She loves horseback riding. We love being outdoors and camping and hiking, but find what works for you. There's a lot of our girls here in Alabama that do some adaptive dance classes. There's just so many different opportunities, keeping them involved in church. So if you're not sure what's a good fit for your child, reach out to me. I'd love to talk through some ideas, find out what y'all's family is into, and then help you find ways to get your child in the community for several reasons. It keeps them active, it keeps them engaged, but it also keeps our kids in the public eye. Awareness, like Paige said, awareness starts with people being interested in our families and our story and our kids. And if we hide our kids away like they did years and years and years ago, there's not going to be enough interest or enough people knowing how amazing our kids are. So get out in the community, keep your child active. That includes teaching others to communicate with your child. Like Paige said, we've got the communication handbook, which is amazing. Prepare them for school transitions. I just had Alyssa's huge transition meeting today for transitioning to the middle school in August. And again, we were just starting our baby steps, but you don't want to wait until August to do that. So if you have any questions about transitions to school or to different schools, feel free to contact me. I am a special ed teacher of 24 years. So that is kind of forefront in my brain. I'm helping a school here in Alabama transition another child with Rett, as well as one over in Georgia and another in Florida. So I'm happy to be a resource for school issues. I'm happy to read over your child's IEP and give you just some personal feedback if you're interested in that. So again, use me as a resource if needed. And then create an All About Me book. Now this, we used to think when we started this All About Me book, it was just for school, but I have found it's great for caregivers. If you have caregivers coming into your home, and we all know how frequently those can change or turn over, have an All About Me book for caregivers. Have it for teachers, therapists, even extended family members that maybe you're not around your child as much, because then you're not just continually repeating yourself about just general things on how to communicate. It's all in there, and they can see what is your child interested in, what do they love to do, how do they communicate, and all the different things that they've accomplished, like milestones that they've reached. So I love the All About Me book. I keep a running copy for Alyssa and update it, every 6 months to a year for whatever the new setting or situation she's going into. I'm happy to share that if anybody wants that as well. Some upcoming events. I know there was one question on the submitted questions about how can we stay more connected. As a family empowerment rep, we had this on our national call just the other day, and we all brainstormed and had the idea for like a virtual mom's night out, which I'll be sending out a link, and we'll set a date and a time, and you can bring your favorite water or whatever your favorite beverage is for the evening, and we're just going to hang out. If your child is there in the background screaming, guess what? We get it. We don't care. If you just want to come on and laugh and have a good time, come on. We're going to do it. I'm going to try to schedule once a month. I may try like one on a weekend, one on a weekday, move it around so different families can fit it into their schedule. So be on the lookout for that. In the past here in Alabama, we've done picnic or events where we had meals together. And again, with COVID, we've had to postpone that. We are really aiming to try again for the fall, probably something similar to our last one out at Oak Mountain State Park, with a rain check possibly at St. Mark Methodist Church, where we've had rain checks in the past. So again, be on the lookout for that. And then we continue to have frequent get-togethers for families who come to Birmingham for clinic. We just had one this past Monday night for a small impromptu visit of a family. So if you're traveling to Birmingham, for clinic and you're going to be here all day or spending the night, let me know, because I've got a group on Facebook Messenger that I can message in a heartbeat, and we can get a quick dinner together just to get families together. We love to be together. We love to eat together. We love to see all the kids. So get in touch with me so that I can get the word out that you're coming into town. And finally, I'm going to show you our Alabama resources page. It is updated, new and improved. There's still a few corrections to be made, but I wanted to show you what we've got as of right now. So if you go to the rettsyndrome.org website, this is what you will see. And again, this is similar for anybody, even if you're not in Alabama, your state has a resources page. So follow along with me. Here is your, you're going to go to for families, and that will click through. And while my computer's loading, go to the Ascend Summit. I cannot tell you, I've traveled all over the country going to conferences, meeting families, hanging out, having a great time, learning so much. And I'm so excited about the Rett Syndrome Summit in April of next year, because it's close. I'm not having to fly or drive hours and hours. It's in Tennessee. Take this opportunity and join us, because it's going to be amazing. All right, we are now at the family page. So if you scroll down, you will see that you've got different options here. If you go to this resources tab right here, you will get some different options for resources. At the bottom, you'll see state resources. Click there, and it will bring you up a handy dandy map of the United States for you to pick your state, and that is where you'll find your state resources. You'll see they've got it highlighted as far as where the Rett clinics are as well. But if I click on Alabama, it's going to bring up all of our resources, excuse me. So right there at the top, you'll see the Family Empowerment Representative. That is my contact information. So if you missed it on the first slide, it's right there on the website. So feel free to go there. It also connects you with Samantha Brandt, who's our National Family Empowerment person. And then we go down, you will see the information about the UAB clinic, biobanking, that is collecting DNA, collecting samples, and that's right out of UAB as well. The Governor's Office on Disability, local state Medicaid. All the time I have parents asking about the Medicaid, how to get on Medicaid, how to get Medicaid waivers. All that information is right here on your resources page. Early intervention, if your child is under the age of 3. ADAP, that's a great advocacy program. If you need an advocate for school issues or advocacy in the community, they're there to help. There's information on preschools, adult programs, rehabilitation, special needs trusts. There's AL-HIP. So many of our Alabama families still don't know that if you are on Medicaid or on a Medicaid waiver, Alabama HIP program will pay you. They will reimburse your insurance premium as long as you keep your primary as your work insurance and then use Medicaid as a secondary. So they pay all of our premium for that every month. If you need more information, call me, email me, text me. We've got information on legal counsel for guardianship, conservatorship, local school districts, even down to how to get your handicap placard in your for the motor vehicle. There's also a place for parent recommendations. So if you find a great resource, send it in on this website at the bottom. There's a place to send in resources, and they'll add them to our page. We've got a few things about travel, you know, the zoo, the botanical gardens. We tried to find something in each region of the state, even wheelchair accessible beaches down in Gulf Shores, and wheelchair transport. So there's a ton of information on here. I'm going to stop now so we have time for questions, but be sure to go on and check out all the resources. And like I said, if you have resources that you're interested in that you don't see, contact me. I'm constantly looking, trying to help everybody. So give me a call, give me a text, or give me a email, and I will get in touch with you soon.
Great. Thank you, Susan, so much. Oh my gosh, you inspire me. I want to be you when I grow up. Thank you for all of your efforts and your support, your generosity, your big heart. And I'd like to invite the Alabama team to come back on with your webcams, because we said that we would wrap this up in an hour and a half today. And it's a lot to cover, but it's really good. We haven't been able to be together in person, and there's been a lot of change. Things feel like they stayed still in some domains, and in many other domains, there was a lot of progress. Things are changing at Alabama. Things are changing in the Rett community. Things are changing with resources available to you. You are changing as your child ages and goes through different stages of, into early intervention, to preschool, to elementary school, to middle school, to high school, to after high school programs, to adult programs. There's just really exciting things that continue to happen. Nothing has paused. Thank you for all of your wonderful information, everybody. Thanks for bringing your camera back on. Dr. Ananth, thank you for staying with us. Okay, what I'd like to do is I am going to stop sharing my screen. You all sent in some great questions, which we have shared with our presenters. And but for the purpose of accelerating us through the next 10 minutes, I want to remind everyone that if you have a question for any of our presenters, go ahead and put it in the question field now. We'll see if we'll have some time to get to them. But let's start. If you can go ahead and unmute your phone. I'm going to start with some research questions. So Dr. Percy, that's going to put you back in the hot seat here for a little bit. Okay. And if anyone has something that they want to chime in about to help answer any of these questions, feel free to do so. Okay. So our first question that came in specifically about research is, Dr. Percy, if you can talk about opportunities at Alabama for older girls and women to participate in any of the studies at your site.
Unfortunately, all of the studies in older individuals are essentially closed, and we're really dependent on the pharmaceutical industry to develop products that are open to trials. These could be existing drugs that have been repurposed for use in Rett syndrome, or they could be new drugs that arise out of translational research for Rett syndrome. But at present, we do not have any new studies that at least I know of. I don't know if anyone else does, but I'm not aware of any. One thing I could say about clinical trials is that in order for a clinical trial to be effective, parents have to sign up. If there's nobody signing up, then a clinical trial will fail. And the only way we will have drugs available, or any therapy available, will be if it can be tested and shown to be effective, and then it can be rolled out to people in general. Now, let's say that a drug is approved based on study in younger children. In general, the age range is extended beyond that to all individuals in general. But even once it's approved, physicians can use it based on their judgment, regardless of the age range.
Well, and also the opportunity is there for natural history in older participants too. We have not stopped learning everything we need to know of all ages. So that's a really good way, while we're waiting for a clinical trial to open maybe again in older women, or is to stay involved, get involved in the natural history study.
Well, that's very important, because Rett syndrome is really a young disorder. It's only been widely available in the world since 1983. And the gene wasn't identified until 1999. So it's a young disorder. And the majority of girls in the natural, individuals in the natural history study are 20 or under. We do have some older women, but very few above the age of 40 or 50.
Yeah. Thank you. It is a continuous learning process, and everyone who will make your child available to participate in research, it's really where we're at. And it is an exciting place to be, where now we're not just raising money for research, but we are actually participating in research. And that has happened just in my lifetime as a parent on this journey. So we've participated in research. We do every time we can, and we encourage you to as well, to the level that you're comfortable with. And you can only get comfortable with it if you make yourself informed about what's out there and talk to this fantastic team. They can get you to that place of trust and over that hurdle of anxiety. So thank you, both Susan, for your participation in multiple studies, and of course to the team at Alabama for being the primary investigator for so many of these studies. It really takes a trusted partnership to put our children into research programs, and we wouldn't do that without the confidence that you were there every step of the way. Okay, we have a couple of questions about the trofinetide trial. We have one question, Dr. Percy, from a parent of an adult. They participated in the first eligibility for enrollment. Their child was an adult when the drug was known as NNZ-2566. And they have a question about any ideas from you about when this drug might make it through phase 3 and become available as a prescribable.
Well, the whole issue of going through various phases of the clinical trial is frustrating for everybody. It takes a long time. So in general, for a drug, you have to first test it in older individuals and then test it in younger individuals for safety and with some signals for efficacy. And then you move on to a phase 3, which is a registration trial. If that trial is successful, then the company can apply for release of that agent by the Food and Drug Administration. The only trial that we have for a phase 2 that really is phase 3 that really has gone to this extent is the trofinetide trial, and that is a little more than halfway through their total enrollment phase. So the company hoped to conclude enrollment by May, or probably optimistically, but June of this year. And once that is done, then that is the double-blind portion, and those data can be analyzed, which can take 6 or 12 months. And then the company, if it decides that it has substantial data, will apply to the Food and Drug Administration. So we understand that's frustrating. It's frustrating for everybody. And it's only at that time that an agent would be deemed safe, which is the primary role of the Food and Drug Administration, and effective, which is also critical. But for this person, it's going to still be 1 or 2 years.
Okay, and a follow-on question from another family of an adult who participated and is now outside of the age range. Can you comment, do you have any insights into the 005 and why it's restricted to ages 5 to 20, and if any of the folks who previously participated in an earlier phase but are beyond that age bracket, if there's been any opportunity for them to participate?
Unfortunately, no. That's something they was approved by the Food and Drug Administration when they put forward the trial, and they have to stick to the requirements that they agreed to and that the FDA agreed to.
Okay, thank you. Thank you for sharing that. I know it's a hard balance of that safety, efficacy, and an approved trial. And for those of us with a child or a loved one with Rett syndrome, we want this to happen immediately, right away. But from a scientific perspective, everyone is on it. Things are progressing as fast as they safely can and as the data allows. So I know it feels like an eternity, and getting these answers, be patient, it's coming. It gets exhausting sometimes to hear that, but it really is progressing and it really is advancing. So hang in there, everybody. Keep your eyes open and your ears open and keep reading, and progress is happening. Okay, we have a couple of questions that are very timely for the pandemic and for COVID and for vaccines. If you have a minute, we've got a question about your recommendations and your feelings in the state of Alabama and surrounding states as well, but particularly about getting back to social activities, attending school, day programs as they reopen, and how our girls are handling exposure to the COVID-19 virus. Can you talk about that a little bit from your experience, Dr. Percy, Jane, Dr. Anand, anyone, please? I think families are just looking to hear about experiences and your advice and thoughts.
I've talked too much. Jane, you got any thoughts?
Not about that. That's you and Dr. Anand need to handle that one.
Well, you know, first of all, the situation has to be established as safe. You have to evaluate the school, whether they have proper social distancing, they have a reasonable number of children in the room, they have appropriate numbers of caregivers, and they may have a mixture of on live and then online or Zoom kinds of services. But I think you have each individual family has to assess the situation, make certain that it's absolutely safe. I think one of the possible and maybe probable advantages of younger children is they seem to be at less of a risk of having significant illness or transmitting it. But I think once you get into the middle and school and upper levels, the potential risk increases. So you have to be very, very careful, make certain that the school system is safe. We have a father of a girl with Rett syndrome who's a high school principal in Montgomery. And he said they have moved all of their classes to the gymnasium where they can spread the desks out and have adequate social distancing for high school level students. So again, when you have teachers and administrators who are looking at the situation from that point of view, I think you can be rest assured if such a situation is happening at whatever school your children might attend.
Okay. Thank you, Dr. Percy. It is a very difficult time of transition, and we appreciate your recommendations and your care. Dr. Anand, we've had a question. If we could hear from you for a little bit, and I think your little one has gone to sleep. I hope we, which is a good thing for you as a panelist and a speaker. But I hope it doesn't mean that our topic today was boring. I know my kids find our presentations a little boring sometimes.
He's pretty used to virtual meetings now.
Yeah, a digital citizen, I think.
Yes.
Going to grow up knowing nothing different. Thank you so much. We are so happy to have you as part of the team, and we'd really like the community to get to know you a little bit. So would you mind closing us out today with a little bit about your background and any of your thoughts about the pandemic, about caring for children with Rett syndrome? We would just love to hear from you for a few minutes before we wrap up.
Sure. So my name is Amitha Anand, and I trained as a child neurologist in at Texas Children's in Baylor, and then went on and did genetics training at Stanford. And but I was born and raised in Birmingham. I went to medical school here, and we wanted to come home and be close to our families, and we were very blessed to have the opportunity to do so. So that's a little bit of my background, and it seems like I've managed to go to places where there was a large Rett syndrome presence. And so I was very excited when I got the opportunity to start to work with Dr. Percy. I did my pediatrics training actually at Children's Oakland at a time when Dr. Percy was doing traveling clinics with Jane and actually was able to go to one as an intern. So that was pretty cool for me. With regards to pandemic, I think the CDC guidelines for safely reopening school, I think most people hear safely reopening school, but really that is with enough people, masking and social distancing and all of that and kind of stuff. And it feels like the numbers are going down, we're getting vaccinations, that things are headed in the right direction, which they are. I'm very optimistic, but our overall number is still of cases in Alabama is still higher than it was in the summer. So I think we have to be careful as we are approaching the end here, that we sort of maintain safety for all of our patients and ourselves. So, but I totally understand that it's not the same virtual. My daughter hated anything virtual, and so it's if you're confident that your school is doing things in a safe manner, and I think a lot of schools are trying their best, then that you'd have to kind of judge risks and benefits that way.
And we realize that sometimes is the only place that the person gets therapies. So it's a real catch-22.
It really is, yeah. This has prolonged, and kids are not getting access to the really essential services. They fall into the category of the most vulnerable populations. And so I wish everybody the best of luck of learning how to live in this environment and have continuity of care, continuity of services, and use your best judgment. And you've got some experts who are willing, I think, to talk through any concerns to get you to a place where it's right for your family and for your child.
I'd like to say one thing about vaccines. When you have the opportunity to have your child vaccinated, you should take advantage of it. Currently, depending on the vaccine, you cannot vaccinate your children who are less than 16 or 18. Eventually, trials, and I think Dr. Fauci said that today, eventually trials will be run in children. I think they're probably ongoing already. And by the end of the summer or early fall, the vaccine should be available for all children. And it's just as I would vaccinate for measles, mumps, rubella, chickenpox, DPT, diphtheria, tetanus, and so on, and the annual flu. I would vaccinate for this. I've had my 2 vaccines. I know Jane has, and I think Susie has at least 1, if not 2. And Amitha has been vaccinated. So we are firm believers and supporters of vaccination, and that is the only way we can mitigate this terrible thing.
Thank you, Dr. Percy. And we have one of our attendees who has let us know that her child is getting ready to get her first vaccine tomorrow. So we have eligibility to consider, we have availability, and in coming weeks that'll change, and we wish that this family the best of luck. Thank you for sharing that news with us. Thank you for the encouragement, Dr. Percy, to get your vaccine. I'm glad you all are getting it, and variable reactions, first dose, second dose, but so far no adverse effects, and only the hope that we can all get back to normal ahead of us if we can get these numbers down. So I promised everyone that we would wrap up. You all, it's 5:30. It's happy hour in Alabama, and I know my hour is happy from being with you today, this evening, at the end of a long week, of a long spring. We have signs of spring, end of a long winter, a long year. Thank you for taking the time to let the community know how much progress has been made despite all efforts to make us stop. We won't ever stop. You can count on rettsyndrome.org. You can count on this incredible team in Alabama. We're here. And everyone knows Susan Lee. Susan, thank you for you. Susie Geertz, we didn't get to hear from you. You turned your camera off. But I know that you personally have affected the trajectory of height, weight, growth, development for children worldwide because of your efforts out of Alabama. This community is so fortunate to have you in their community. Thank you for sharing your expertise, your commitment with all of us. We have a few writing.
You're welcome. Thank you very much.
Yeah, would you like to say anything? Any parting words of advice? Dr. Percy's was get vaccinated. Susie, what's your words of wisdom to share with everybody before we close up tonight? Put you on the spot.
Yeah, I agree with their comments about the vaccine and everything. To me, it was just such an honor to be able to get it. And so I know that other people are going to feel that way. I look forward to working with families down the road still, because I know we're going to have new families coming, and it's such a privilege to be able to watch everybody grow and change and to have some say so about that and to be able to assist these families. So, and there are lots of things on the horizons too in terms of nutrition, so we can look at it together and we can learn together. So thanks. Nice to hear from everybody.
Hey, Paige, I do have a quick question I want to address real quick. I know we had a whole sheet of questions that we didn't get to. Is there going to be a way for the panelists to answer some of these questions and have you send them out,
Thanks.
like in an email possibly? I just want to make sure that families get answers to some of these questions because there's some really great questions on here. Oh, I can't.
You're
I can't
muted,
hear you,
Paige.
Paige. I think in one of our previous webcasts that we did, and she turned off her camera. I think in a previous webcast, the panelists were able to go through and answer some
Yeah, so we
questions.
targeted the ones that were very specific to the call, and I'm sorry that we had to take those decisions.
Yep. Do it.
Yeah, that's right. I don't know if my audio came back sometimes. Is the audio okay?
Yes.
It's in it.
All right. You also, yes, we will take the questions, we will develop a QA, and we'll send it out to everyone who registered today. Okay.
Excellent.
Thank you all so much for your time. Families, new and older in the journey, thanks for being with us.
Thanks.
Thank you.
Bye.
Hi, guys. Thank you.
Okay, everyone, have a good evening. Thank you. Bye-bye.